Today's presenter is Anna Endres, Head of Strategic Health Services at Discovery Health. Anna joined Discovery in 2010 and over time has grown the portfolio of areas she supervises, which currently include Africa Health Insurance, Discovery Healthcare Services, where she heads a portfolio of healthcare provision businesses, which include pharmacy, home nursing, health coaching and wellness, as well as the digital health platform and special projects unit, which developed a strategy, pilot and launched digital health and innovation programs at Discovery. It's a mouthful, but there's more. Before joining Discovery, Anna was a strategy consultant where she advised a range of clients in Europe, United States and Africa. She also worked at Johnson & Johnson as an international product manager based in the UK, where she managed a brand of medical devices with annual sales of $145 million across 38 countries in Europe, Asia Pacific and Africa. Anna has a graduate degree in chemical engineering. She specialized in biotechnology from, and I hope I pronounced this correct, Anna, it's from the Instituto Superior Técnico in Portugal. And she's also got an MBA from IESE in Spain. Now, Anna grew up in Portugal, but her husband grew up in South Africa. They met in Costa Rica while on an MBA study course. Anna Endres lives in Johannesburg with her husband and 3 very cosmopolitan children. They have a Portuguese mother, a South African German father, and have already 3 different passports. I really feel honored to have Anna as our presenter and appreciate her time for preparing and presenting this. So welcome once again, Anna. I'm looking forward to your presentation and it's over to you.
All right, well, thank you so much and for the really lovely introduction of me and my family. So my presentation today is going to focus on some of the trends in digital health that we've seen in the last few years, as well as the impact that the COVID pandemic has had on actually accelerating this trend and this uptake. And then lastly, without putting too much emphasis on, but I'll just share with you some of the Discovery Health's kind of latest offering in the digital healthcare space as well. For interest's sake, and perhaps some of you may be Discovery members, and it might be a useful thing to know. So just starting off a little bit with the digital health platform evolution, which has been going on actually for quite a while, for more than a decade. And what we've seen is that what started off largely as electronic health records being at the core of what digital health was at the time, about a decade ago, and the objective was making the health system more interoperable, sharing some of that data with the different providers, etc., has then evolved into the second wave, into other digital health models that really were able to deliver superior quality at lower costs. And in that, we kind of incorporate things like telemetry devices, so remote monitoring devices, as well as telehealth and virtual consults in general. And then also some of the healthcare applications, some of the health apps that have kind of sprouted across a whole host of different medical conditions.
I'm enjoying my coffee. She's from Discovery Health.
I read it. Yes, interesting. You have to tell me.
Yeah. I think this is very nice.
Apologies,
I'm not sure if everyone else is hearing a second
I'm not
conversation.
sure where that is coming from. Is that part of your, was it in your presentation?
That is not part of my conversation, no.
Sherry, I think I'm going to mute everyone who is not muted. It's possibly, sorry, you can carry on.
Continue. Thank you. And then moving on to the last more recent wave, which is really where we're now trying to pull together all these digital tools that have been developed and actually try to orchestrate smarter experiences across a whole host of communities. And so this last wave really brings in some of the buzzwords, like we're now doing ecosystems, healthcare ecosystems, that really what you're doing is trying to create intelligent journeys nudged by intelligent analytics that drive people across the different players and partners that are part of the ecosystem and push up engagement in that manner. And really do this across entire communities. So patients to patients that share the same condition, or patients with their entire host of provider care team members, be it the diabetic nurse educator and the doctor and the health coach, etc., etc. So that's really the world we're in today. And so if I just play what some of the features and the developments that have happened in these health ecosystems, they really kind of get bucketed in about 6 key pillars of functionality. So they cover, these tools and features cover everything from screening, wellness screening, diagnostics, and remote monitoring. And then, also into the area of virtual care delivery and all the telehealth capabilities that exist there. They also include a lot of features around disease management and digital therapeutics, be it, education around a condition or nudging to the next best action that you should be doing to manage well that condition, to kind of coaching, be it, artificial intelligence based coaching or even with a human. And then a fourth bucket, which is around medicine management and selection. And that really is around e-scripting, medicine adherence tools that I know Johan was telling me about. He had tried some of those as well, and all the way to medicine delivery service at your home. A fifth bucket is around clinical intelligence and really enabling the doctors to, to be supported in, creating those electronic health records, being nudged for which of their patients in their population of patients that they have, which of their patients should be nudged for the next best action, and even supporting doctors in what the next best action should be in the case of a specific diagnostic, etc. And then lastly, a lot around automation and digitization of some of the pathways. And so around administrative pathways such as billing and some of that workflow automation that can be done. And also some automation for members. So automating the identification of who's the right provider that is fully covered by their medical scheme, etc. All of that automation is also part of this kind of digital health pillar. So this was just to give you a sense of how broad the features of digital health these days really are. And all of this movement in digital health has really been accelerated by the pandemic and is today in full force. So it's not a surprise to us that a lot of health insurers, if I look at some of the key investments and activity that has happened in the past year in 2021, it's not a surprise to see on the left-hand side how many of the very big health insurance companies in the US and broadly in Europe have, continues to invest heavily in digital health. You can see some examples there. United Healthcare continues to acquire data analytics companies. Humana, also a very big US player, acquired a digital health solution player that actually delivers a lot of care remotely at home. Aetna partnered in 2021 with another digital player, in this case a mental health platform, etc., etc. You can see a lot of examples there of traditional health players continuing to invest in digital health. And what was also really interesting to watch was how much the big tech companies, which are not traditional players in healthcare, have invested in healthcare. And I just shared with you a quote from Tim Cook, which is the CEO of Apple, which basically, says that he believes that Apple's greatest contribution to mankind will be about health, and empowering basically individuals to manage their health. And really this is at the core of why Apple and other big tech companies have invested so heavily and recently even more so in the healthcare industry. So just to give you a sense, and just positioning now a little bit around these big tech companies, to give you a sense of how well positioned they are to fight some of the traditional players in healthcare. You see there, between Apple, Google, Microsoft, Amazon, and Facebook, you see the scale that these companies have in terms of either active devices or, users, or even searches per day that occur on their platforms. You see how much cash they have. This is, a huge amount of capital to fund all sorts of investments in new cutting edge solutions. You also see that they have been doing so and acquiring a very large number of startups. And this is just the number of startups they acquired in the last 10 years and that are related to artificial intelligence. So they have been on a strong acquisition drive across the board. Apple, apparently further ahead than the others, but I mean, all of them really having a very big acquisition drive. And so they are using this power that they have of huge client bases, lots of capital, to invest in the healthcare space. And so if you look at some of the examples that happened in the last year or two by some of these companies, Amazon, for instance, actually launched 3 big companies healthcare related: Amazon Care, Amazon Pharmacy, and Amazon DX, which DX focuses on diagnostic devices. Amazon Care is basically telehealth, and Amazon Pharmacy is the delivery of medication. They've managed to launch these 3 huge businesses in healthcare all in a single year. And they are also expected to enter direct contract arrangements, in healthcare for employers. And so that is entering, and making a huge investment in the industry. From an Apple perspective, they've actually launched a fitness platform to kind of push their wellness agenda, and actually piloted running their own subscription-based telehealth service called Apple Doctors. Microsoft, for instance, acquired a very large player in speech analytics called Nuance. And Nuance basically has speech analytics in the medical field. So it's able to, for instance, translate what doctors are talking into doctors' notes automatically, so that the doctors don't have to type in. And lastly, Google not only acquired Fitbit, also to invest in their wellness side of things, but also invested in a number of diagnostic companies, biopharma, etc. So this is really what in the last year or so all these big tech players have been doing in the healthcare arena. And they weren't the only ones, because even fintech players, so financial technology players, have invested in healthcare arena as well. And you see there a couple of examples. Meditrusts created basically a platform where they join patients, pharmacies and pharma companies, and basically allow credit and payment solutions to be put forward to patients that can't afford their medication right away. And so they basically provide credits and other type of solutions and link themselves with these pharma companies in order to get the medication to the people, and then the payment coming in the installments later. And similarly, see there another one that is simplifying a lot of these online payment processes in the healthcare side of things. So these are just some examples of how non-traditional players have been pushing into the healthcare arena as well. So looking at all of these trends, and if you take a step back and try to summarize what possibly the 4 key trends that cut across the healthcare industry are, these are the ones that I would pick that are the absolute latest. So one is, you can see people are and health insurers are, building digital platforms these days. They are real builders of digital platforms and analytical engines and journeys, and they are partnering with a lot of third-party providers, partnering or acquiring with a lot of third-party providers that give them devices to integrate on the platform, or apps or services to integrate on the platform. A second one that I would also highlight here is the expansion of remote care. It's basically, there's a move towards doing healthcare at home, everything in healthcare at home, be it wellness assessments at home, and normal virtual telehealth at home, and even doing hospital at home. So things conditions that would typically, or acute events that would typically be treated in hospital, are now being remote monitored at home and treated at home. Doing palliative care at home. There's literally from the whole spectrum of care is now being done at home. A third trend that I would highlight is the very intense use of artificial intelligence in healthcare, and what started off by being possibly a lot of artificial intelligence usage around population management and care, clinical care of the person, developing analytics around predicting a deterioration of a certain disease, or predicting who is likely going to be diagnosed with a certain disease by looking at the claims pattern, etc., has now expanded into analytics around workflow, back office automation, etc., etc. So there's a lot of AI being used in healthcare at the moment. And then lastly, after a decade of building lots of different features of digital healthcare features, the focus is now basically on engaging people with those features. So sustained user engagement is now really the focus for anyone who owns a digital healthcare platform, and creating those simple, proactive journeys and that really engage both members and providers in the care. So that's probably my summary of some of the trends, latest trends in digital healthcare. And what I wanted to now take you through is perhaps the impact that the pandemic has had in accelerating this uptake. And I will start by showing you, a proxy for this digital healthcare uptake, which is the virtual consults and the volume of virtual consults that have happened. So as you are probably all aware, with COVID, two things happened. One is that a lot of the regulatory barriers around virtual consults were dropped. Specifically in South Africa, some of the barriers that we had prior to the COVID pandemic were, for instance, regulations that insisted that you could only have a virtual consult with a doctor that had seen you before within, in the last year or 2 years or so. So you couldn't just have a virtual consult with any doctor that was available at that time that you wanted to have a consult. It had to be someone who had physically seen you before. And that shrunk the pool of doctors very significantly, and the pool of time slots available for whenever you wanted a specific virtual consult. That barrier got dropped during the pandemic. In addition to that, there was another force, which is the fact that now both doctors and members had a much higher motivation to actually do things with distance and keeping that distance in place. So members were not so keen to go to the doctor's rooms, and doctors also at the peak of the pandemic were understanding that to protect themselves and the rest of the patients, doing virtual was an important thing. So you could see that this was a phenomenon that affected the whole world. On the top graph on the right-hand side, you see there how many times the number of virtual consults increased over the period of the pandemic. So you could see right at the beginning when the lockdown was the stricter. Globally, you could see 80 times higher the number of virtual consults that had existed versus prior to the pandemic. As kind of the new normal came up, the restrictions around lockdowns also decreased, etc. The number of virtual consults started decreasing as well, but never came back fully to the numbers that were pre-pandemic times. So we still see globally, and especially in the US, about 38 times higher number of virtual consults than pre-pandemic times. Then the bottom graph actually tells you what we saw at Discovery Health here in South Africa. So very similar to the global graph, and very much characterized by the waves that we ourselves had in South Africa. You could see there that we had an increase by 30 times at the beginning of the pandemic versus the pre-pandemic levels of virtual consults. That also has decreased as the new normal kind of got established, but we still have at least 5 times higher than what the pre-pandemic levels were. So a more moderate effect in South Africa than in the rest of the world, but definitely, following some of those trends. And the work to kind of drive digital health, especially at the maturity level that digital health is today, which is not at its peak yet, right? It's an exponential growth, but not yet at its peak and well embedded in everyone's life and behavior. And that uptake is a continuous push, and it's a continuous push across a number of different streams. So we continue to make sure that the regulatory landscape is as favorable to drive digital healthcare as possible, that the awareness of these digital health solutions is there. We continue to try and simplify the digital journeys so that people can actually find digital even easier than what they already know and are used to in the physical world. Specifically at Discovery, even drove certain incentives across all stakeholders. So if you look at, for instance, the member side of things, we drive vitality-like incentives and programs to try and get people to use condition management digital tools that we have developed. We also have certain subsidies and to doctors that actually drive some of our hospital at home programs. For instance, they do supervise those members virtually, and so we've had to create new payment codes and billing codes to allow them to actually bill for those supervisory services that they do virtually. We continue to kind of push the use cases, the number of instances that you can do things digitally in healthcare. So to give you an example, if virtual consults were easy for people who were just following up with their own doctor, or were doing, for instance, their own session with a psychologist, etc., which is mostly a talk, then that is fine to follow up with on your chronic management disease, or talk to a psychologist. That was an easy session to be done online. It was a little bit harder if you actually needed to diagnose certain things, like if the doctor needed to look into your ear or see into your throat or hear, into your lungs and heart rate, etc. And so we've had to actually, in order to expand those instances where a virtual consult could be had, we've had to integrate with a number of additional devices that allow the doctor virtually to look into your ear and to your throat and hear your lungs. So that's also some of the areas we've had to push. And then lastly, the topic of access, because some of these devices, for instance, are expensive and are not available just anywhere. And so, we've had to work hard at bringing those devices into South Africa, making them available, and negotiating availability of some of these devices, for instance, at the Apple Store, or even if in the case of devices that are more expensive, to also find solutions like the ability to rent some of those devices for the period that you're actually being observed, or whilst your kids are 5 and 6 years of age and plagued by lots of diseases, then you use this device, but this device is perhaps less useful when your kids outgrow that phase, and so you don't want to buy it for forever. So we've had to kind of help the access to these things via contracts with leasing companies and renting out these devices, etc. So there's a lot of different pieces of the puzzle that need to be acted on to try and continuously drive and, bring down the barriers that digital health may have. So that kind of takes me then to, the specific examples of what Discovery Health's digital platform offering has been. And I would like to perhaps just to make this a little bit more illustrative, to actually show you a few videos on the digital platform that we have at Discovery, and then explain a little bit of what is entailed there. So this one is just a video that will give you a sense of the broader platform that we've been building and continuously build on, the ecosystem we've been building on. Some of these features are already live. Some of them are, becoming live towards the end later this year, but at least it will give you a good sense of what those are. I'm hoping that the sound will play. Sorry, let me just try again.
We are enhancing healthcare delivery with an intelligent connected care ecosystem driven by real-time data and insights from predictive analytical models to deliver a more personalized healthcare experience by enabling all stakeholders to coordinate care. Jeanette Blair is a 42-year-old female who has been identified to be at risk of diabetes after her recent health check. Her results trigger alerts from our risk prediction models on her personalized dashboard. The risk assessment tool shows how changing lifestyle behaviors can change her long-term predicted risk profile. Her doctor is alerted of Jeanette's risk profile on the dashboard and can request a virtual consultation. Her doctor can immediately send an e-script, and Jeanette can track her medicine adherence in the electronic pillbox. Her doctor then recommends appropriate devices and a health coach for high-touch interventions to help manage her condition. Her health coach connects through virtual chats and will recommend personalized condition-specific information and apps. Healthcare is now more connected and personalized than ever before.
So I hope that gave you a sense of the platform that is being continuously built on. And as I say, we've been accelerating our investment in the digital health, and done so in conjunction with a number of third-party devices, apps, and services. And these are just some of the examples of those that have already been integrated into the platform, or are about to go live soon. So as you can see, we've got solutions around the diagnostic side of things, which is at the top there, and you see there from a diagnostic perspective, very much connected to the virtual consult world. You see TytoCare is the device, for instance, that I was telling you about, that allows us to basically conduct a virtual consult whilst the doctor can see everything in your body. So that's one that I'll even zoom in a little bit later and show you a little bit more about. But you can see a whole host of other integrations that we're planning to do in that area. You also see that this platform also caters for acute care. On the right-hand side, you see some of the integrations that have already happened with analytics platforms like Biofurmis and Pixelier, as well as devices like BioBeat sensor that you see there, as well as the Biofurmis sensor. So these are devices and analytics that allow us to remote monitor people and track their metrics, a number of their metrics, continuously 24/7, and then over and above, based on the results of those metrics, there's continuous data analytics AI running that is capable of alerting us whether there is a deterioration of any of those metrics, and the alert pops up to the supervising doctor and to the doctors, the remote center that is filled with doctors watching these patients remotely, and those alerts pop up and the doctors can act on it. On the bottom hand side, on the bottom there, you can actually see also some of the partners and integrations we've done for addressing chronic care. So we've got integrations, for instance, with the Mayo Clinic that has developed a very comprehensive set of library leaflets, let's call it like that, about every single condition and surgical procedure, etc. And people can find out a lot more about the specific condition they have. We've also integrated with a company called My Health Teams, which has developed online patient communities. So communities where digital communities where patients like yourself, communities around diabetes, or communities around mental health, or communities around long COVID, etc., get together and discuss their issues, as well as some digital therapeutics. In this case, you see there, we've been piloting a couple in the mental health space that we think could help some of our mental health, some of our members that suffer from mental health conditions, and that has increased so significantly during the pandemic, as well as some in this case you see on the right hand side a glucose monitoring device, and so it's a telemetric device. The glucose monitoring would be for diabetics, but there's a range of other telemetric devices we're integrating as well. And then lastly, on the left-hand side, you see all solutions that we're exploring and about to integrate on the screening side of things. So diagnostic robotics is a tool that actually is a symptom checker. So you basically plot in some of the symptoms that you're feeling, and it's AI basically starts walking you down an issue tree that tells you what, therefore, you know, the diagnosing to some extent, but kind of telling you what in all likelihood your problem is, and therefore what you should be doing. Should you see a doctor, should you not, etc., etc. Some retinal screening machines as well for broader wellness screening. So there's a number of devices, apps, and services that we're hooking onto our platform and have already hooked onto our platform that allows us to deliver a lot of these services. So I'm going to zoom in on those two in yellow, the Title Care and the Hospital at Home. And so just to perhaps start off with the Title Care so that everyone is aware of what that is and what it allows. I'm just going to try and hopefully the video will play. Let me see.
Imagine a doctor who can be here in these rooms, but also far out of town, who can ease a new mother's mind here whilst treating an ear infection here. Check up on patients here and here.
And now can you just stop there?
At the same time, a doctor unaffected by traffic, the weather, or even this. At Discovery, reimagining the future of healthcare is what we do. And with virtual consultations increasing dramatically around the world, we're introducing a world-class telehealth device to take virtual consultations to the next level. Members can now have a comprehensive medical examination with a doctor online from the comfort of their own home. With the Title Home device, anyone can quickly capture and transmit ear, throat, and skin images and lung and heart sounds, enabling a better diagnosis, an immediate electronic prescription from the doctor, and a real-time medicine ordering tracking experience, connecting members to doctors like never before. Access to quality healthcare from the comfort of your home is a game changer, wherever that might be.
And now, unfortunately, we couldn't see. We could hear the sound of the video, but there were no pictures.
Resubscribe to Life Mills Plus today.
Sorry.
Maybe if you can just show us the image of the device that they spoke about.
Perfect. Sorry. Let me then. I'm gonna. Can you see my image now at the moment then?
Yes, we can see that.
Okay, perfect. So apologies, that was the one video that we didn't test. I suppose that the same will happen to the next one that I have on Hospital at Home. So I'd rather just talk through it rather than show you. So this is the device. As you can see, there is a device that has a very high definition camera. And you basically, with some attachments that you put, you can either put that camera looking inside someone's ear, or you can put it looking inside someone's throat. So you just change the attachment, and basically you can put the camera doing that. You can also just lay the device next to the chest, and the doctor will literally hear the lungs because it's got also very high definition there. And this device basically gives the doctor the ability to, in real time, examine all of these areas. So he can examine ears, lungs, throat, heart rate, temperature. He can do the same on your abdomen, can take pictures of your skin, and basically sends a live feed of these images to the doctor. I hope that has clarified it for everyone. And so this is how it comes through to the doctor. It's a live feed on the Connected Care platform, and the doctor is basically on the telehealth consult, just receiving the live feed of all of those images as well. I'm just then going to move to the next one. And I had here, once again, a video for hospital at home, but I'm rather going to just talk to it because I'm afraid it might not play out properly. So hospital at home is powered. So it's the ability to be able to take some of those acute events that were previously being treated at in the hospital. I'll give you examples. For instance, someone who has acute pneumonia, for instance, and needs to receive IV antibiotics. Typically, people were taken to the hospital to do that. And now all of those things can be done at home. The person will be remote monitored as well as they will, they would have been in hospital, certainly for those conditions. It's not ICU type of care, but it is certainly hospital level type of care. And so what we basically do is we give, there's a nurse that comes that sets up a remote monitoring device, which you see there in the middle, some of the examples of these devices. So one is just it's a patch that you put on your, it can be a patch that you just glue on your chests, like you would have had a similar one in hospital, or it can be one of those bracelets, let's say, that you put on your arm, and it's still monitoring all of your metrics. So for instance, the patch that you see down there, it literally monitors heart rates, oxygen levels, temperature, blood pressure, etc. There's a number of metrics that all gets monitored via those patches. And so all those readings 24/7 are being sent back to a doctor who is always seeing the entire population of people and seeing any of the alerts. And so I mentioned to you the alerts. It's got a lot of AI behind to understand and identify when there's any sort of deterioration or things that are of any concern. And those immediately pop alerts. And so this is that person is being continuously monitored whilst the nurse will come to your house 2 or 3 times a day, whatever is the appropriate care that the supervising doctor has set out in your treatment plan. And so the nurse comes, does the physical things, checks once again a lot of the measurements, gives the IV infusion or whatever else is needed, does the wounds, treatment, whatever else is needed. And this is all being therefore supervised by a control center of doctors, as well as your own doctor, who can literally log into the connected care platform and see anything that's happening to you or any of his patients. And we are able to, in this manner, actually support up to 37,000 hospital admissions per year right from the start. We've already identified that there are at least 37,000 hospital admissions that today are done in hospital that could be moved to the home. And as we expand the capabilities and the tech of this hospital at home offering, we would be able to actually start catering for even a higher percentage of hospital admissions. We could actually be looking at about 160,000 admissions that today are done in hospital per year, that actually could be done at home safely and more cost effectively. So that's what one of the other uses that digital health is allowing, and that Discovery has launched. So that was just to give you a kind of a brief flavor of the digital healthcare space and some of the Discovery Health offerings there. I'm very happy to answer any questions that you may have so far. So perhaps, I don't know, Johan, should I stop sharing and just get back to just seeing everyone?
Yes. Well, and firstly, I think we are entering a new world of healthcare, much more than what I actually thought or anticipated. So yeah, thank you for that very well and comprehensive overview of what's happening. I'm sure there's lots of questions. The first one here is from Penny. I don't know if you can see the chat panel, but Jenny has posted in the chat panel. How would this impact on people with hospital policies instead of general medical aid?
So, and I can only speak right now, I can only speak for discovery plans, right? I don't know what all of the other medical aids are allowing or not allowing. So the idea here is that you are always given the choice. Basically what we're saying and what we saw, because we've been doing home treatments via our home care business, home treatments now for more than 5 years. And I can tell you that, 98% of the people recommend the treatment at home. They much prefer it. They say it's so much more convenient for them. They much rather be at home if they can. And so what we're creating here is an option that is safe for you to be at home and be treated at home in that manner. You will be covered in the same manner. So whether you choose or what your doctor says you actually should be treated at home, or your doctor says it's actually very safe for you to be treated at home, you will be covered in the same manner. You'll be fully covered one way or another. It's yours and your doctor's choice to do one or the other. I hope that answers the question.
And now I think to add on to that is a question from Jeff. Now, Jeff is always asking these sort of tongue-in-cheek questions, but I'm sure he's serious about this one. He's asking, is the move to hospital at home because it's better for the patient or better for the medical insurer?
It's better for both. It's better for both, really. So like I said, the patients love, they thoroughly recommend being treated at home. That's the surveys that we've done over and over for the past 5 years say so. And it also is good for the medical insurer, and in this case for the scheme, because obviously it's a more cost-effective way of continuing to keep treating people. And bear in mind that if it is good for the scheme, a lot of that ends up being good for the member later on again, because if we find ways to keep health costs, cost effective, that means that, the scheme doesn't have to bring up the prices, the premiums every year by as much. So obviously it's good for everyone. That's really what we're trying to aim for here.
Thank you. And Bernard asks, are the health records being shared and accumulated to assess the population health trends?
They are being used and shared to the benefit of the individual as well as the population. So at an anonymized level to understand population trends. So yes, and they are being used on both. Let me give you an example of the first one. Today, if you give consent to your doctor is able to see your electronic health record that we've accumulated at Discovery Health for the nearly 3 decades that we've had some of the members on. So that's those records are important, and we think very valuable, and so do the doctors, are important for them to understand the full person and to be up to date with what this person has done across other other specializations, etc., healthcare specializations. So at the individual level, certainly, and subject obviously to the member providing that consent. And then at the population health trends as well. So if you want to manage diabetics in general, let me give that example. If you want to manage diabetics in general, and we want to understand how to risk stratify the different diabetics, and based on that risk stratification and segmentation, what kind of interventions make sense for one segment versus another, and try to drive those interventions at that level. All of that is also being used, and the doctors are therefore being nudged in their entire population of patients. So to say, Mr. Doctor, if I look at all of your diabetic patients, for instance, here are the 5 that belong to a very high, a very high risk within that condition, and that you should be, really pushing for closer care and more interventions and things like these. Let me alert you if they haven't done what they're supposed to done in terms of the pathology that they should be doing every three months, or the visit to the diabetic nurse educator that they should be doing every year, or the podiatrist they should be seeing every year, etc. Let me alert you and help you engage those members in their own care. So that would be a kind of a population level analysis that is being done as well.
Good. Penny, just unmute yourself and put your question to Anna.
Hi, Anna. I'm just thinking, with all these additional role players, isn't this going to be a whole lot more expensive than just going to your normal doctor or just your hospital admission?
What do you mean by role players? So you're not talking about the digital tech specifically, you're talking about the care team in general, or?
Yes, the care team in general, because you've got nurses coming 2-3 times a day, and you've got this one and that one, and a whole panel of doctors monitoring your symptoms and so on.
So in reality, no, it's not more expensive. What is happening is that, a day in hospital is actually pretty expensive. And in this case, what we do have is, first of all, you get the benefits of scale. So you've got doctors, a doctor seeing many patients that are being remote monitored by a single doctor, right? So many patients in one go, with the alerts all popping up and the doctor acting on what he needs to act. But there's a scale benefit there. From a nursing perspective, actually the cost of getting a nurse to go 2 or 3 times a day to your home, or however many is appropriate, it might be less, it might be more, on average is actually less expensive than having you in a full kind of day at hospital and paying for all of the things that the hospital will then charge, including doctor's time, etc. So in reality, all over the world, these hospital at home programs have shown, depends on the implementation, but have shown anywhere up to 30% savings versus a hospital stay. And obviously in the US, where healthcare is really expensive and hospital care is really expensive, 30% is probably what they get, and it's pretty significant. And perhaps in settings like South Africa, where the care is perhaps not as expensive in hospital as it is in the US, the savings would be slightly more modest, but we do believe that there are savings and have been able to prove that there are savings no matter what.
Hi. Probably not in your line of work, but I just wondered offhand whether you've been in any meetings with Discovery where they've discussed the upcoming national health scheme by the government and how it affects you for your company.
So it isn't my line, and therefore I am not up to date on the latest of what is happening there. I can tell you probably a bit more general than what you would like to hear. It's something that you probably could have picked up on the news as well. But what I can tell you is that as Discovery, we continue in conversations and are part of all of the groups that obviously are discussing the proposals that are coming through. we support, you know, as a NHI, the idea, we support that idea. We do want the NHI, you know, framework though to come with a role for the private sector, as you can imagine. And I think that the discussion is what is the role and how would that come about. So I think it's an ongoing discussion, and we are, you know, open and always kind of sharing as much information and data with the government on all of the pertinent subject, like all the things that could be of relevance to that discussion. But it's an ongoing discussion, and you know, we obviously just want to make sure that we all achieve you know, great care and access for everyone in South Africa when it comes to healthcare, and we believe that the private sector has a role to play in there.
Thank you very much.
And I just, from my side, that one device, the discovery of a device, is it called Taito Care or something?
Correct.
Yeah. Now, if I'm a Discovery member, how available is that device, and what's the process to get it and to start using it? How should one go about it?
So, so if you're a Discovery member, there are certain segments of Discovery members that have actually, you know, are actually subsidized from the scheme to get this device. So, for instance, we know that people who use a lot and probably would find virtual consults more convenient are young families that have got young kids that are always sick. I myself, as you said at the beginning, I've got 3 young boys. They're always sick, and I find the convenience of doing virtual consults and be able to kind of show the throat and the ear, et cetera, just makes it so much easier for me. So for young families, that's one of the segments where the scheme is able to subsidize a part of this device. But this device can be ordered by just actually contacting MedExpress. MedExpress, for those of you that may or may not use, but it's our kind of pharmacy-linked service of delivering medication to your home. If you're a chronic member, you know, it's quite convenient because you don't have to remember that you need to buy the next month of medication. It's just kind of, you just confirm that you wanted it, it gets sent to your home. And so it's via MedExpress that you would put that order through. If you go to the website and you just type MedExpress, you'll see the telephone number that you can call them on. And then MedExpress will arrange for the delivery of this device into your home. That's how Taito Care is being delivered to Discovery members today. If you're not a Discovery member, you can buy it at the Apple Store, for instance, at the iStore here in South Africa. And so once you have it, it's a fairly straightforward setup process. And then if you want to schedule a virtual consult with a doctor that is trained on Taito Care, then you just go to our connected care platform to schedule a virtual consult, and you will see a range of doctors. You just filter by a doctor that has got Taito Care access, and you will see a range of doctors with different slots available, and you can then do the consult that way.
Good. Final question, last one from Cherry. Sherry, is the Discovery Health ecosystem available to members in all provinces in South Africa?
Absolutely. I mean, it is a digital platform. So by definition, is, you know, available pretty much everywhere. So there might be certain parts of it that at the beginning, at the stage, are, you know, they cover 80% of the national territory. So to give you an example, today, MedExpress delivery, for instance, of chronic medication to your home is available, I think, around 80% of all of the territory. So if you live in a very, very remote area, it might be harder to get some medication over to you, especially those that are that need to kind of keep cold chain, et cetera, et cetera. Similarly to hospital at home, we currently have got nurses in Western Cape and KZN and Eastern Cape and Gauteng. But if you live in in Limpopo, or then it might be more difficult for us to get a nurse to you, because our network of nurses currently cover where 80% of our Discovery members sit. So by and large, yes, there might be a few instances where not, but for instance, a virtual consult is independent of where you sit. Wherever the doctor sits and wherever you sit, you just connect. So in those type of features, then it's available to absolutely everyone, no matter where you are.
Thanks, Anna. I think maybe just to add, provided you've got good internet connection, I think that's the first step for all of this.
Fair enough. Fair enough.
Thank you very much, Anna. I really appreciate your efforts for this presentation, and the content for me, it was really a lot of new information which I was not aware of. We can all applaud you.
Thank you. Thank you so much. It's been a pleasure. And I hope you have a great rest of the day.